Hello, I'm Dr. Gary Laux. I'm a pain management physician at Atlantis Orthopaedics. I focus on musculoskeletal problems and painful spine conditions. So herniated disc, pinched nerve, basically any neck, back pain that radiates to the arms or legs, shoulder pain, knee pain. So overall musculoskeletal care, but with a focus on the spine. Yeah, so I was around healthcare growing up because my father was a chiropractor and his focus was on spine care. So it's something that came naturally to me. Over time, I knew that I wanted to go into medicine, and this was an area that I had interest in. I went to medical school in Long Island. I went to New York College of Osteopathic Medicine. I did my residency at NYU in Physical Medicine and Rehabilitation, and then I did some subspecialty training here in Melbourne, Florida at the Deuk Spine Institute, which is spelled D-E-U-K, and that's where I learned the fluoroscopic guided injections that I do today. You know, with every patient, there's a full exam, obviously, correlating the imaging studies, whether it be X-ray, MRI, the physical exam findings, coming up with a diagnosis, and then a treatment plan for each patient. You know, obviously using the least invasive method first, which would be typically, medications, physical therapy, and then leading up to injection. And then if there is a decision, I refer out for surgery. I like the patient care. I like taking care of patients. I like talking with them, see, how their daily lives are going and how the treatment is affecting their lives. And when I'm not doing this, I have two children, my son that's 3 and my daughter that's going to be 6, and I spend a lot of time with them. My subspecialty training was in Florida, in Melbourne, Florida area. This is the first job I've had, and I've been here ever since. So I've been here for over a decade now. My basic training is Physical Medicine and Rehab, which focuses on musculoskeletal complaints, the function of the patient, rehabilitation of injury and musculoskeletal problems. My subspecialty training is pain management, which is a focus on basically the injections that can provide relief for patients, and those are fluoroscopic guided or X-ray guided. So an example of that would be an epidural steroid injection, a facet injection, and those are things that can help with spinal pain. We offer physical therapy here, so that's something that we often refer patients to. And obviously we're trying to do the least invasive care first, to then something that may be more invasive, which would be something like injections or medication. That's something else that I offer also is radiofrequency ablation. Basically, it's a heated needle to cauterize a nerve that may be causing pain. And I do that for the shoulders, the knees, and then obviously the spine.